Where is the pain right now? In the back? And it's going down. So Fatima is suffering from rheumatoid, and you can see the changes here. This is the deformity in rheumatoid. In rheumatoid, every joint is involved practically. Her right hip has been replaced 2 months back, and now we'll start the neurological examination. I'm touching both the sides. Can you feel equally? There is no numbness. All right. Move your toes. Okay. So there is no neurological deficit as such. There is more pain on this side, correct? So first I lift this leg. If there is any pain, just tell me. There's pain there. Okay. Bend your knee. The hip has already been replaced, so we know that rotations are fine. Knee is okay. And now we'll do SLR on this side. Keep your leg straight. Pain? Okay, correct. So this is not a typical prolapse disc, so SLR is bound to be normal. Hip is fine, knee is okay. Great. Namaskar. We are with Fatima, who is from Petersburg, South Africa. She is 61 and she is suffering from rheumatoid arthritis. Because of rheumatoid arthritis, her multiple joints are involved, but one development that is slightly peculiar about rheumatoid, not very common, she has a spondylolisthesis of L4-5. Actually, she has been suffering for more than 10 years. She had one episode in 2011, which was treated conservatively, but now this time, when her hip was replaced about 2 months back, she had a recurrence of low back pain, and this time there is severe pain in the left leg as well as in the right gluteal region, and that's why Fatima is with us.
6 months ago. Before that I was taking prednisone.
Prednisone. So it's basically you are taking steroids for a long time.
Yeah.
That actually sometimes contributes to the osteoporosis and this sort of problem in spine. That could be a contributing factor. Okay, so right now I can see that sitting for maybe half an hour, 20 minutes is painful for you. You cannot sit more than that?
I can.
You can, but with pain.
It's only the back rest I need.
You need a back rest. But luckily there is no numbness in your legs, there is no weakness in your legs. That means neurologically you are intact, which is a very good sign for us, because if people come with foot drop or weakness, then the recovery is slightly, I would say, incomplete. Okay, so main problem is backache, correct?
I think our whole life evolves around this pain now, and it's affecting her mentally as well.
Yeah. So 61 is not an old age, because people are now working till 75 and beyond. Means we are more aware about our health basically now. So considering the health facilities available around the world and your awareness and the way he has researched the whole thing, you deserve a good quality of life. And that is the whole purpose of this thing, that we are together so that we can give you pain relief, stability of the spine, and you can at least walk 3, 4, 5 kilometers every day. And whatever sort of hobbies that you have, you want to travel, you want to do so many things. I would love to see you living a normal, full, perfect life. That's my aim of this surgery. Any questions that you have, any apprehensions about the surgery? Must have some questions.
I thought I'll be cured one. She told me. I feel that I'll become paralyzed, like what is here.
So I didn't get her.
She's got a fear that she may get paralyzed because the olden days, the spine problem,
yes.
they're very advanced.
That's a very good question. And actually, the advantage of endoscopic spine surgery is that we are seeing things 20 times magnified. All your nerves, all your spinal cord and all those things, we see on a screen like a video game 20 times magnified. So when a thing is 20 times bigger, there is hardly any chance of mistake technique. That's why we are doing only endoscopically. We are not doing any open surgery now. 99% of spine surgeries are now endoscopic. 1% only in case of tumor. When we have big tumors inside the spine, then we have to open it.
Scared of the pain. Right?
You are scared of this pain or the pain after the surgery?
Pain.
After the surgery.
It will be, I promise you, it will be less than the pain right now. So this is a very good case of good case in the sense technically speaking. A good case of listhesis is grade 2, grade 3. Generally we get grade 1 and grade 2. Grade 3 and grade 4 are very rare cases. It's a grade 3 case, and we will bring the bone back, we'll stabilize it. The disc that is not working, we'll put a new disc and we'll stabilize. We call it 360-degree fixation. So your spine will be fixed properly, and next morning after surgery you will be walking. My aim is that within 24 hours you should be able to go to washroom yourself. That is my aim. Right? So I thank you, all of you, that you have reposted your trust in our team. You have come from so far away, and it adds to my responsibility that I'll give you a perfect result. All the best. Everything will be all right. ये फातिमा का MRI है सर्जरी से पहले, तो इसमें आप नंबरिंग देख सकते हैं L2, L3, L4 एंड L5. नॉर्मली जो हमारी वर्टिब्रल बॉडीज़ होती हैं दे आर इन स्ट्रेट लाइन, या देखिए आप बिल्कुल सेम लाइन में रहती हैं, लेकिन यहाँ आप देखिए ये बोन यहाँ है और L5 पूरा पीछे चली गई है. इसको हम कहते हैं लिस्थेसिस, यानी कि एक वर्टिब्रल बॉडी जब दूसरी के ऊपर स्लिप हो जाती है तो इसको स्पॉन्डाइलोलिस्थेसिस कहते हैं. तो ये देखिए बोन कितनी आगे आ गई है और जो L5 है वो पीछे रह गई है. जो डिस्क है वो एक तरह से यहाँ पर पूरा लीक हो गया, उसका जो जेल मटेरियल होता है, इसको सूडो बल्ज कहते हैं. इसकी वजह से पेशेंट को पेन तो है ही, साथ साथ अगर आप देखेंगे ये जो हमारी नर्व्स आ रही हैं ये भी यहाँ पर स्क्वीज़ हो गई है, यानी कि इनके लिए रास्ता नहीं बचा है, तो इससे पेशेंट को लेग्स में भी पेन होता है. तो इस सर्जरी में हम दोनों बोन्स को आपस में एक दूसरे के ऊपर वापस लाएंगे, फिक्स करेंगे, डिस्क भी नहीं डालेंगे और नर्व्स को भी डिकम्प्रेस करेंगे. ये फातिमा का सर्जरी के बाद का एक्सरे. इसमें आप देखेंगे कि अलाइनमेंट हम वापस ले आए हैं स्क्रूज़ और रॉड के साथ. तो जो बोन पहले यहाँ थी उसको हमने वापस पुल कर लिया है और अब लिस्थेसिस करेक्टेड है. दूसरी चीज़ आप देखेंगे, ये जो डॉट्स आप देख रहे हैं ये बेसिकली हमारी डिस्क है, जो हमने नई डिस्क डाली है इसके बीच में. और एक नई चीज़ इस एक्सरे में आप देखेंगे जो आपको पहले फिक्सेशन में नहीं दिखाई दी होगी, ये जो वाइट मटेरियल है जो आप देख रहे हैं स्क्रू के दोनों तरफ, इधर भी आप देखेंगे ये पूरा वाइट जो आप दिख रहा है, इसको सीमेंट कहते हैं. बेसिकली ये स्पेशल स्क्रूज होते हैं जिनके अंदर छेद होते हैं, और इसमें जब सीमेंट, बोन सीमेंट इंजेक्ट की जाती है तो ये चारों तरफ बोन को ग्रिप कर लेती है. आपको जैसे याद होगा कि फातिमा ने स्टेरॉइड्स भी काफ़ी लिए हैं और ये रूमेटॉइड के पेशेंट हैं, तो इनको ऑस्टियोपोरोसिस है. तो कई बार ऐसा होता है कि स्क्रू लूज़ हो जाते हैं, तो उसको बचाने के लिए हम ये सीमेंटेड स्क्रू डालते हैं. तो इससे क्या है कि होल्ड बहुत अच्छा आता है और पेशेंट को कभी आगे प्रॉब्लम नहीं आती. So this is after 1 week of surgery. जब हमारे पास आए थे तो she was not able to walk, she was on a wheelchair, she was walking with a walker and with lots of pain. Though the gait is still unsteady because of several reasons. उनका हिप भी रिप्लेस हुआ है, नी में भी प्रॉब्लम है, but now there is no problem with the spine. Come. How much is the pain in the back now? As compared to before surgery?
Very minimal.
20%? 10%?
Yeah, about 20%.
Say, okay. Sir? Yes, please. So I think that is the freedom that we give to the patient with endoscopic technique, that patients can start doing their daily activities within a week. She was in severe pain when she came. Okay, okay. After a week of surgery, Fatima is with us and now she is planning to go back to her country, South Africa. So we were with the family for last 7-8 days, and patient was in different phases of pain and slowly towards recovery. This short journey that we traveled together, I just want your comments, means how you feel, means what were your expectations when you came to us, and were we able to somehow, to some extent, fulfill that? Any feedback for our team, for our services that you want?
No, I'm feeling much better now. I didn't expect it to be so quickly.
Okay,
Yeah.
thank you.
Everybody was very good here, everything.
Actually, you were also very anxious before surgery.
Yeah,
What will
very,
happen?
yeah.
Paralysis and all those things we were talking about.
Yes.
But luckily everything has gone well.
Yeah.
Actually, that is the advantage of endoscopic technique. The chances of complications are much less. Any surgery that you do, we have to weigh the risk and benefit. So risks are much lower. Benefits are as good as they were in open surgery. And because we are not damaging any bone or muscles, the recovery is fast. That is the technical part of it. So first day there was too much pain, I remember. Right? And I told you before surgery that first day will be very painful, and you sometimes would feel that why did I go for surgery? But after that, slowly you feel better. So how much distance can you walk now? Is 50 steps, 100 steps?
I walk quite a bit now, more
Okay.
than 100 steps.
So you are comfortable walking?
Yeah, I still call that fear, but I'm walking now.
Fear is
slowly,
there,
yeah,
yes,
fear is
yes,
there
yes.
that I don't fall. That's the only
Mhm.
thing.
Yes, yes. Because our other joints are also not
Yes,
in
because of
perfect
the
shape
hip, yeah.
because of rheumatoid. That is understandable. Sir,
No, our expectations, you went above it basically.
thank you, thank you.
I would say you're not only a good doctor, but you're a good human being also.
Thank you very much.
You kept us like, you made us feel comfortable in every way. And I want to thank you all. And even Sunny, you're also a very good person. You helped us a lot. No, I want to thank you really greatly.
So that is the whole idea basically,
Yeah.
that we are not just treating the disease, we get connected to the family. So that whenever you come or whenever you talk about us, you talk to us or you feel like that it was a family. It was not a doctor or a staff or a hospital. So that's what we try to do.
Yes,
And most of the times we are successful.
yes, we were very comfortable. Even she got comfortable. She came with anxiety initially, but then she settled down
Means
quite
this
well.
smile, this is my biggest reward.
Yes, yes.
Great. So I wish Fatima all the best, and I wish that she do everything she wants to do in her life. She wants to travel, she wants to visit places, she wants to attend ceremonies, functions, religious places, wherever you want to go, you should. And any problem, anytime, we are with you. I mean, phone, WhatsApp or email, you can talk to us. Thank you very much for posting your trust in us, keeping the trust in our team, because we met for the first time. We never met before.
No, never.
Generally before surgery we meet the surgeon 2 times, 3 times, 4 times, we discuss so many things, but you came with a blind faith. So that is a huge compliment for our work and our team.
No, we really appreciate Doctor, really.
Thank you.